This video teaches how to perform effective aseptic technique. Because aseptic technique is generally developed through ritualistic nursing, much ambiguity surrounds this practice. Aseptic non-touch technique, or ANTT, is the first theoretical framework for aseptic technique based upon the best available evidence. This said, it is probably not radically different from your practice now. You may ask why in these modern times work is being invested in something as basic as aseptic technique. Well, there's a very good reason. Every year, 5,000 patients die of infections acquired in hospital. This is a major clinical governance issue, as a number of these infections are transmitted to patients by staff performing aseptic technique. In other words, because of poor aseptic technique, some of these patients entering hospital won't be leaving it. But you can make a difference, and this video shows you how. The development of ANTT. ANTT was developed in 1996. A number of hospitals have since adopted it, such as Great Ormond Street Hospital for Sick Children and University College London hospitals. All the recommendations and guidance given in ANTT are based upon a theoretical framework made up of 3 parts. 1. Problems with practice. 2. Lessons learned from the literature. 3. Using correct terminology. Let us look briefly at each of these 3 components. Part 1. Problems with practice. There is strong evidence that current aseptic practice is often poor and patients are put at risk. Imagine if you were a patient and consider the potential harm from these practices. Hand washing is often inadequate. Like here, the nurse wears a watch, it's too quick and has poor technique. Key parts are often contaminated, like this, as the process of flicking off the needle contaminates the syringe tip. Aseptic fields are often inappropriate or simply not used, like the use of a windowsill here, or bedside tables and locker tops, or even the patient's bed sheets, like this. And even when aseptic fields are well chosen, they're often managed badly, like here, increasing the risk of contaminating key parts. Very commonly, key parts aren't cleaned properly or given sufficient time to dry. Remember, if it's still wet, they aren't aseptic. One study showed that when wearing sterile gloves, staff felt it was safe to touch key parts, like here where the thumb is used to cover the key part whilst mixing drugs. Unfortunately, these are not uncommon sights within hospitals. In summary, practice is often poor, highly variable, and there is no standard approach to aseptic practice. ANTT addresses these problems in practice. One of the ways it does this is by providing a prescriptive clinical guideline. Part 2. Lessons from the literature. As well as lessons learnt in practice, ANTT is based upon a number of lessons obtained from an extensive and ongoing review of the literature. Reference works include guidance from the Department of Health, Infection Control Nurses Association, Centre for Disease Control, COSH regulations, and many other sources. As you can see, ANTT is based upon the best available evidence. Part 3. Using correct terminology. Terminology used in practice today is often inaccurate, ambiguous, and like practice, highly variable. Common terms used include clean technique, aseptic technique, sterile technique, non-touch technique. Such different terms can confuse healthcare workers, and not least, patients. The choice of accurate terminology is actually very simple. By definition, the term sterile technique is not achievable in typical healthcare settings, whereas the term aseptic technique is achievable, and a non-touch method is a fundamental aspect of maintaining asepsis. Therefore, practice should be termed aseptic non-touch technique, as this terminology is accurate and, most importantly, is achievable. Linking theory to practice using ANTT. Having standardised the terminology for aseptic technique, ANTT aims to standardise practice too. Standard approach to aseptic practice is important as it helps prevent ambiguity and poor practice, as well as facilitate effective audit. A very good way to standardise practice is to use a clinical guideline. The ANTT clinical guideline standardises what staff do and, importantly, what order they do it in. This is an example of an ANTT clinical guideline for IV therapy. It has 8 steps. Let's look at these steps in some detail. Step 1. With clean hands, gather your equipment such as drug ampules, syringes and needles so that they are all close at hand around your aseptic field. Like this plastic tray, your aseptic field should be robust, easy to clean, portable and have high sides in order to prevent sharps falling out and helping to contain any spillages. Clean your plastic tray with an alcohol-based surface cleaner like this. Start inside and finish outside. Step 2. Whilst the tray is drying, clean your hands with either alcohol gel or soap and water. Hand washing is the most important aspect of ANTT. Here, the infection control specialist from UCLH in London demonstrates how to perform effective hand washing in well under a minute.
So make sure that the water is not too hot for you. Wet your hands thoroughly. Apply your soap. Make sure you rub it all over your skin first and then start washing your hands, rubbing your fingertips, your thumbs in your palms, backs of your hands, the fronts and palms of your hands, the back, and ending up with your wrists. Having done that, rinse off thoroughly, make sure all the soap is gone.
Remember, it is important to ensure that all parts of the hands are washed thoroughly, especially the palms, thumbs and fingers, which are all commonly missed. Doing so will help remove most microorganisms from the crevices in your skin, which are acquired from patient and environmental contact. Lastly, remember that to help prevent hand soreness, always pat rather than rub your hands dry. Step 3. Put on a pair of gloves. Glove choice is straightforward. Ask yourself if the procedure can be performed without touching the key parts directly. If the answer is no, choose sterile gloves. If yes, choose non-sterile gloves. Note well, on the basis of this risk assessment, non-sterile gloves can be used safely for most peripheral and central access procedures. Gloves are primarily used to protect you from exposure to drugs like antibiotics in accordance with COSH regulations. In ANTT, the focus is always on getting the basics right, not inventing special rules for different patients. Therefore, in ANTT, the patient's age or diagnosis has no bearing on glove choice, nor does the route of intravenous access, as standards of care should be equally high for peripheral and central intravenous access. Step 4. Now assemble your equipment using a non-touch technique, taking care not to touch the key parts, such as this infusion bag port and the giving set spike. Part of a non-touch technique is to protect key parts when they aren't going to be in use, like protecting this syringe tip with a sheath needle. Being able to identify and then protect the key parts of any procedure is the most fundamental aspect of ANTT. In IV therapy, key parts are those parts which come into direct or indirect contact with the liquid infusion, or in other words, those parts of the equipment that, if contaminated, could infect the patients, such as this needle and injectable bung. In reality, there aren't usually many key parts in most procedures. A typical procedure like this one has 5 key parts, which must remain untouched at all times. Step 5. Once prepared, it is important to go straight to the patient so as to minimise any environmental contact. Now, prepare the patient by ensuring that you have clear access to whatever type of intravenous access device they may have. Step 6. After preparing the patient, you must now make your hands aseptic again. Remove your gloves, re-wash hands and re-glove. Step 7. Clean the injectable port on the intravenous access device. It is essential you clean this kind of key part very vigorously. It will look clean, but microbiologically, it'll be very dirty. Use different bits of tissue to prevent just moving the dirt around. After you've scrubbed the port, clean the sides, moving away from the end. It is very important that you allow this key part to dry before you use it. If it's still wet, it's not aseptic, and you place the patient at risk. It takes about 15 seconds to dry properly. Once dry, administer your drugs using a non-touch technique. Step 8. The last stage of ANTT is one of the most important. Gloves create a greenhouse effect for organisms on your hands. It's therefore imperative that you clean your hands immediately after gloves are removed. The way in which ANTT is introduced is key to its effectiveness. Just declaring ANTT as a policy or displaying a clinical guideline alone is not enough. In order to ensure that standards of ANTT do remain high, ANTT must be introduced as an audit cycle based on at least an annual cycle of audit, staff education and assessment. Research shows that if practice is not monitored and assessed in such a way, then standards will deteriorate and patients will be put at higher risk of acquiring hospital-acquired infection. It's that simple. In summary, any ANTT guideline must be based upon the following 3 components. 1. Effective hand washing. 2. An appropriate aseptic field. 3. Key part protection by a non-touch technique. By utilising these factors in a prescribed way, the ANTT clinical guideline provides a logical and standardised approach to aseptic technique. Thank you for watching this training video. Please remember, every year 5,000 to 10,000 patients die of hospital-acquired infections. By adhering to ANTT, you can make a difference.